Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita Valens. Are you living it up like I am?
Living it up. Feel great.
We had a great lunch at Mountain Gate Country Club last weekend, didn't we?
We did. Great way to spend a Sunday looking at the beautiful golf course, the rolling hills.
Oh, my God, it was gorgeous.
Gorgeous.
And we got to reminisce about the old days.
That's right. Although I'm not as old as you, I can only go back so far. But, you know, you're ancient, but you're in such great shape. I couldn't believe it. You look the same for 20 years.
Yeah, pretty much the same for the last 100 years.
I'm telling you. It's great to be immortal. I admire you for that.
But, you know, Anita, we're doing a show about musculoskeletal here, about pain.
Yes.
And I wanted to ask you a question, why I'm doing this. I'm thinking of removing my spine. Do you know why?
So you can run faster.
Kind of. I feel like it's only holding me back.
Ho, ho, ho. You snuck that in. That was slick.
I did. I shouldn't do that to you.
We want all our listeners to feel as great as we do, so we want them to be pain-free. So if you're in orthopedic pain, what's the number they should call right now to talk to you?
Well, if you want a free copy of my book, which is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with the lovely Suzanne Summers doing the introduction here. You can give me a call right now. I'm going to send this out to you for free. It's got, let me see how many pages. I'm looking through it. A lot of pages, almost 200 pages, 250 studies, real studies, science. You guys love science, especially the doctors who are listening to the show. They always go, where's the science? So I gathered it all together on how PRP, platelet-rich plasma, and stem cells work to grow tissue and heal the body instead of doing surgery. There's a lot of studies in here showing that surgery is not a great way to try to heal the body because it takes tissue out in most cases. Now I'm just talking about surgeries that I don't think should be done. But anyway, getting back to the phone number, we'll get into all that. Write this down, everybody. If you're driving, pull over to the side of the road, turn off your Bluetooth so we can hear you. And we want to talk to you guys right now and answer questions about your musculoskeletal pain, things that hurt from the head down to the feet, all the joints, arthritis, rotator cuff tears, labral tears, meniscal tears, you name it. We take care of that. And the number is 866-870-5752. 866-870-5752. If you call me right now, I'm going to mail you out for free an amazing book on stem cell and platelet therapy and why it is that you should not do surgeries unless, of course, it's an emergency and you need to. I'm not against that, but I am against many of these surgeries because I have patients come in all the time, every day almost, who say they need to get a surgery. A friend said they shouldn't do it. They should come see me because they had great results just using platelets, PRP, and or stem cells, and they didn't need to do the surgery. And we find out that most people do not need these surgeries. I had one. It failed. It made me terrible in my shoulder when I was a dummy in med school.
How long did that pain last?
That was about a 4-year painful journey. And I'm not sure it ever would have healed, but I tried an experiment, which was injecting prolotherapy. I had done my wrist, which was injured from hitting a golf club into the ground way back. I'm trying to think how far back that was. That happened, that happened when I was either in pre-med or med school. I can't remember exactly. Or maybe, I think it was the year in between. and my wrist was hyperextended, and all my ortho buddies wanted to inject me with a steroid. I didn't want that. I don't like cortisone being put in the body. There are needs for it rarely, but most of the shots that are done shouldn't be done, and they actually, if you look up cortisone and cartilage, you'll never get that shot because it destroys the cartilage. So I refrained from doing that. I went to a conference on regenerative medicine. This is, my God, how many years ago? It's probably like 30 years ago or something. And someone there was doing a workshop on wrist. And I mentioned the injury I had, and he said, let me inject you. And I go, I don't want me injected. I'm here to learn. And he said, I think I can fix your wrist. And he examined my wrist, and I acquiesced, and he said, you're going to be stiff for about 24 hours, and then your wrist is going to be a lot better. And he was absolutely right. He injected in several places in my right wrist, and about 24, it was stiff for about 24 hours, and then all of a sudden there was a release of the stiffness, and I was about 50% better. I then self-injected my wrist a few more times, and it's been amazing since. I'm going to actually go hit some golf balls today. I have no wrist pain. But then what happened, I was in, this was actually in pre-med also. There was a girl in my class who was a bodybuilder, and she rode a motorcycle, and we sat next to each other. And I was into gymnastics, weightlifting, and whatnot at the time. And she invited me to come over to her house on the beach where she had a weightlifting gym. So she had one of her trainers work with me. And he said, you know, your lateral pectoralis muscle is not as buff as you'd like the rest of you to be. I was kind of round-shouldered for studying all those years. So this trainer had me spread my arms out, and I did some bench presses, and it ripped up my right shoulder, which is something I teach all my patients. If you're going to be doing push-ups or bench presses or flies or things like that, try to keep your shoulder in a position where it's not being stretched out. Anyway, my shoulder was stretched out and hurt terribly. I couldn't do sports. And then after my wrist healed, I thought, I'm going to try it on my shoulder. And my wife was, when I got home, was lying in bed watching TV, so I jumped in bed with a syringe, and I injected my shoulder with her yelling at me, what the heck are you doing, with other words than heck.
Yeah, we won't go there.
No. And I literally woke up the next morning and my shoulder was completely healed. And that led me to start doing this on my patients. I begged them to let me try this regenerative medicine. In the old days, it was called prolotherapy, proliferative therapy, or therapy that stimulates tissue to grow. And over these many years I've been doing it now, I found that it works really, really well. It's morphed into PRP, platelet-rich plasma, and stem cell therapy, and it's much more effective than it was, to me, at least in my experience, in my practice, than the prolotherapy. There are still guys out there who do prolotherapy, mostly, which means using concentrated dextrose mixed with lidocaine. And I did that.
That's what I did.
Yeah, we did that on your neck. That's
Yeah.
right. You had a really fast healing on that. But I have used it since the old days because it's easy. I just pull out a couple bottles of solution, inject myself. And when my knee was blown out, it helped, but it didn't really do the job. And then I tried platelets one time and then stem cells, and it healed right up. So,
well, I got a surprise for you. We have RJ and Van Nuys.
All right. RJ, Dr. Marc Darrow, how are you today?
Good. Thank you. How are you doing today?
I'm living it up. I hope you are too.
Trying to.
I guess, you mentioned to the call screener that you're 88 years old and you have bone on bone. Are you talking about your knee or your shoulder?
I'm not the 88. My mom is.
Oh, your mama. Okay.
Yes. So she's in pain with her knee. She barely can walk with a walker, and she doesn't like to use, of course, a wheelchair. You know how it is. And I don't want her to. But Would this help with somebody in her condition? They told us it's bone on bone.
You know, I'm glad you started the show off with the term bone on bone, and I'm going to talk generically about it first, then we'll get into your mom's situation. So I have people come in every single day of the week who say they have bone on bone, and their doctor says that they need a joint replacement. And I examine them, and I kind of chuckle, and I go, "You don't have bone on bone." And they go,
that from you.
"Yeah," and then they say, "But the doctor showed me an X-ray, and I can tell where the bones are close together, at the joint." And I say, "That's fine, but there's still motion in the joint, and when there's motion in the joint, there's not bone on bone, because bones are very porous. If there's no cartilage on them, meaning bone on bone, they're not going to move. So the question for your mama is, can she move her knee?"
Yeah, she does. She walks.
Okay. Well, she walks with pain, and so do millions of other people that don't have bone on bone. But surgeons tell people they have bone on bone. It's just it's a way. I'm going to tell you from my point of view, it's a way of getting people to have surgery. I'm not saying they're bad.
She won't have surgery.
Okay. I'm not saying they're bad doctors. It's just their culture is, to me, a negative culture. And I know that because I was trained in orthopedic surgery during medical school, during internship and residency. And after my shoulder surgery, which went bad, I started thinking a different way, looking for other ways to heal. And I found something that seems to be working great. It's not going to work on everybody. And a lot of the failures in it happen because people are too active afterwards and they don't let it heal. Or they have a bad doctor who doesn't know what they're doing, or a nurse that's doing it. And there's clinics outside of the country that people go to for stem cells, and they come to me afterwards, and I say, "Who did it?" And they say, "A nurse did it." I said, "Did she examine you?" "No. She looked at an X-ray. The doctor told her to look at an X-ray." And then most of these people are not even using an ultrasound to look inside the body to see where the needle's going. So you have to be careful who you go to. I always tell my patients when they ask for a doctor in a different field, I say, find the guy who does the most of what you need. Don't go to somebody who does it once in a while, who's practicing. Go to somebody who's the expert. And that's a big problem in this field, because there's weekend courses that doctors go to, and then they hang up the shingle saying they're doing PRP or stem cells and call themselves regenerative medicine doctors. They really don't know what they're doing. The other reason for failure is taking anti-inflammatory medicines like ibuprofen. We want the inflammation to be there during the healing period, because inflammation sequesters or draws fibroblasts into the area where the injury is and regrows the tissue. So one other reason for failure is not enough treatment. I had a woman come in the other day. She had been to like 4 or 5 other doctors to do regenerative medicine. She was a doctor hopper, if you understand what I mean. She didn't stick with anybody, and she came to me as sort of a last resort, and I said, if you want to get better, you're going to have to stick with me until the end. And she said, what's the end? I go, I don't know. I never know what the end is. It's different. I've had parts of me I've healed overnight by injecting myself, and I've had parts that have taken several treatments. We never know. I've had very simple things that have been difficult to heal, and very hard things like very advanced arthritis that seem to have been easy to heal. So we don't treat based on a diagnosis or an MRI or an X-ray. We treat based on the examination and the history of the person. And the first thing I need to do, this would be with your mom, RJ, is to examine her knee and see how it's doing. I don't care what other doctors say. Unless you do this type of medicine and have a lot of success in it, I think most doctors misdiagnose with everything. You know, I recently learned about cardiologists, God bless them, and how they read CT angiograms, which is a procedure where you lie on a table, you get an isotope, and then you get a CT scan, and then they look at the patency or how open the coronary arteries are. And the typical way of doing it gives a very bad outcome. There are new tests now that are more accurate. So there's many people there getting angiograms and cabbages, which is where they crack the chest and put in new arteries, that shouldn't be doing it. Okay? And it's the same thing with surgery for musculoskeletal. They just shouldn't be doing it. There's new ways of assessing things in all of medicine, and unfortunately, doctors are kind of slow to move ahead. Nita, I heard you breathe, which means you want me to go to Arnold because we're getting callers.
That would be correct.
Isn't that funny? I always know when Nita's ready, chomping at the bit. So I'm going to give out the phone number again. Call us now. We love talking to all of you, and I think we can help most of you. And the phone number to the studio to talk to us right now live. Whoa, that's a lot of noise. Whoever that is, turn off your radio. It's 866-870-5752. That's 866-870-5752. Arnold, I understand your feet and your legs bother you.
Hello?
Arnold, how old are you?
Yes, go ahead.
How old are you, Arnold?
I'm 76.
Okay. Do you play 76 trombones?
I knew that was coming.
I never did that, but I play a little bit of tennis.
All right, well, that's good. What part of your feet and your legs hurt you?
Okay, actually, my feet, for example, I think I have neuropathy.
Okay.
And I have problems walking.
Okay.
Lately, in the last 3-4 months.
Okay.
Because I used to walk a lot, play tennis constantly. I slowed down a little bit after the pandemic.
Okay.
But I still play.
Mm-hmm.
But still, the neuropathy or the bottom of my feet is kind of numb.
Okay.
And it's like I'm walking barefoot on stones.
Yep.
And,
well, there's a couple things that could be going on there. Number one, you could have a vitamin deficiency, and there's a test that we do at our office called SpectraCell. It's a broad spectrum blood test that checks for amino acids and vitamins and minerals and things like that, and antioxidants. So that's a test that
everybody. Go ahead.
No, go ahead.
What it is several friends of mine, tennis players, they're neurologists, and they always tell me that I have no cure, that I'm going to be living the rest of my life like that, because the sheath of my nerves are cracked, I've dried out from the diabetes.
Okay.
Which is, I'm a beginner diabetic.
What type?
2.
A type 2, okay. Are you overweight, Arnold?
No, actually, I lost 30 pounds and nothing changed.
Okay. That's not the question, though. Are you overweight?
No, I don't think so.
Okay. How tall are you?
6 feet.
And what do you weigh?
180.
Okay. And are you a big boned guy or a small boned guy?
No, big bone.
Okay, so that might be a good weight for you. I'd have to check. What I would do with someone like you is I'd have you do a food log. That means you write down everything that goes in your mouth for 3 days, and then you email it to me. And we'd find out what the culprit is that's causing your diabetes. I just had a gentleman like that come in the office yesterday. He works out 3 hours a day. He has a family history of diabetes, and he's got a little belly on him. And I said, you're eating the wrong foods. You're eating carbohydrates. And he said, no, I don't eat that. I lost weight. And I go, I can see it. You're eating it. Your tummy doesn't lie to me. I said, do a food log, and come on back and we'll analyze it. He came in really for his knees, which we fixed, and that was a good thing. We did stem cells on his knees, and he's healed up. But then he mentioned the diabetes, and I'm a big advocate of getting rid of diabetes and healing heart disease. So I would need to see you and see what's going on, and this blood test, SpectraCell, will be a good place for you to start. You're not a drinker, are you, Arnold?
No.
Okay, good, because the two main reasons for neuropathy... Sorry?
What I wanted to say that because of the diabetes, a friend of mine, told me that I shouldn't eat carbohydrates, sugars.
That's
only
right.
To eat vegetables. It's a high-protein diet, which I lost 30 pounds in 3 months. And,
I'd have to talk to you more in detail. This is not really what our show is about, Arnold. Our show is about musculoskeletal pain. But there's another study that you'd have to do. It's called an EMG, nerve conduction study. And that would let us know. That would let us know if you really have a neuropathy or not. And then we try to have to figure out how we can heal it, okay? So we're going to move on. We have Leslie here, and Leslie's right thumb is bothering her. Leslie, how long has it bothered you for?
Well, it's been about 10 years, and I've been to a couple of doctors. I got one shot, which did nothing.
Okay, was it a steroid shot?
Voltaren, and I wear a brace on it. I treat it gingerly.
Okay. Was the shot you had a cortisone shot, a steroid shot?
Yes, sir.
Okay. I'd have to look at it and examine it to tell you what's going on. Do you know if you have arthritis in your thumb?
Yeah, he said it was.
Okay. Well, he said it was, but did you get an x-ray to see for sure?
Yes, sir.
Okay. So there's probably some joint space decrease with the cartilage wearing out, and I treat those all the time with great success. We could use platelets from your blood or add stem cells to it, depending, how bad it is. And I don't think I've ever had a failure with that one, but sometimes people don't come back, and I think they've healed, and they didn't come back because they didn't like me.
I doubt that.
I mean, I try to be a nice guy and be funny, but who knows? Hang with me 1 second, Leslie. I want to give out the phone number, and then we'll talk to you some more. So if you want a free book on stem cell and platelet therapy called Regenerate, Don't Operate, please call us right now. I'll send it out for free postage. It's a great book, a couple 100 pages on studies on why regenerative is a good thing for the body and how it grows back the tissue, helps arthritis, neck pain, back pain, shoulder pain, hip pain, toe pain, finger pain, thumb pain, you name it. Rib pain. A lot of people have what we call costochondritis, where, and I've had it before. I fell down, broke some ribs, and this helped me. So really just about, I inject all over the body. Been doing this over 25 years. I learned it when I was at UCLA in my residency, and I've been doing it ever since. I opted out of doing orthopedic surgery, which I loved. I loved doing the surgery, but I saw too many bad things happen to people, and I don't see bad things happen to people when I do this. Mainly good things. If it doesn't heal someone because they didn't follow my directions, at least it doesn't hurt them. Okay? So back to you, Leslie. Your right thumb had one cortisone injection. It didn't help you. And I'm going to tell you that in my experience, using platelets and stem cells heals those things pretty fast. Thumbs, I treat thumbs almost every single day and fingers, and they get better pretty quick.
Well, I damaged it by trying to open a jar. I put too much pressure on it, so it's an injury.
That's okay. It doesn't matter.
Okay.
If it's the joint or the soft tissue, ligaments, tendons, it really doesn't matter because regenerative medicine of platelets and stem cells regrows whatever tissue it is. And there's tons of studies on that. People always come in, patients come in, they said, my surgeon said it doesn't work. And I said, because your surgeon doesn't know what he's doing. He's a surgeon. He doesn't do this.
Yeah.
Nita, are we going to the break? I can barely hear the music.
I was a good candidate for surgery, and I never went back.
I think we're going to the break.
Yeah,
we
are.
Hang
we
with
are
us,
going
Leslie.
to the break.
Hang with us. The phone number to give me a call right now, 866-870-5752. Go to the website, www.lastemcells.com. You can watch videos.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.